Today I'll be doing the cranial nerve assessment for the 12 cranial nerves. The first cranial nerve is the olfactory, and this is testing smell. Can I have you close your eyes and plug one side of your nose, please? You're going to place an object under their nostril. Can you tell me what that smells like?
Deodorant.
Yep. Can you plug the other side of your nose? Can you smell that?
Yes.
What does it smell like?
Deodorant.
Perfect. If the patient was not able to smell anything, that would be a problem with this nerve. The second nerve is the optic. This is testing vision. Can I have you read that sign for me?
Longwood University.
Is it blurry?
No.
If the patient did report blurriness or any vision problems, that would be an indicator that they are having trouble or are having problems with this cranial nerve. The third cranial nerve is oculomotor. This is testing eye tracking and pupil. For this, you're going to stand in front of the patient. You're going to tell them just to watch your finger with their eyes, don't move their head, and you're going to move in closer to them. Tell me when it gets blurry.
Blurry.
Alright, and you're going to move back and forth, and you're going to look at their eyes tracking, making sure there's no nystagmus, making sure their eyes are moving at the same rate. And you're also going to go up and down, again, only following my finger with your eyes, not your head. Again, looking for nystagmus. This is testing cranial nerve 4, which is the trochlear nerve. And then also testing the eyes. You're going to go side to side, again, only following my finger with your eyes. And this is testing the abducens. And again, you're going to be looking for nystagmus. Now going back to the oculomotor, this one also tests pupils. And so for this, you're going to use a light. And you're going to bring the light up to their eye, and you're going to watch for both pupils to move at the same time. Perfect. They should dilate equally as you bring the light away from one side. If one pupil stays dilated while the other one gets smaller, this is indicating a problem with that cranial nerve. The next is cranial nerve number 5, trigeminal. For this one, you're going to have the patient clench their teeth. Perfect. If they're not able to, or you're also going to touch their face. So can I have you close your eyes? Can you feel this equally on both sides?
Yes.
How about this?
Yes.
This?
Yes.
Alright. If there were problems with that cranial nerve, they wouldn't be able to clench their teeth and they would not feel you touching their face. The next cranial nerve is number 6, which is abducens, which is again the lateral eye tracking. Number 7 is facial. For this one, you're going to have them smile. Alright, and this is also sensing for taste. And could you taste your dinner tonight?
Yes.
Alright. If you are doing this on a sideline, if you have salt or sugar, you can have them taste that and tell you which one they are tasting. If they're not able to differentiate the difference between the salt and sugar, or they're not able to smile, that will indicate a problem with this cranial nerve. Number 8 is going to be vestibulocochlear. And for this one, this is testing their balance and their hearing. So can I have you stand up for me? Can I have you stand on one leg? Perfect. Other side. Perfect. You can sit back down. For this one, you're going to want to be there in order to catch them if they do lose their balance. You're also testing hearing with this one, and so you can just go behind them. Can you hear this?
Yes.
Which side?
Left.
What about this?
Yes.
Which side?
Right.
Right? And if they're not able to hear, that'll indicate trouble with this cranial nerve. Number 9 is glossopharyngeal. This is their ability to speak. So can I have you say ah?
Ah.
He also has been talking to me the whole time, so I know that there is no problems with this cranial nerve. Number 10 is vagus, which is the ability to swallow, and it also triggers the gag reflex. So can I have you swallow for me? And you're just going to watch to make sure they're able to do that. If they have trouble swallowing, then, or if they don't have a gag reflex, then that is indicating that there is trouble with cranial nerve number 10. Cranial nerve number 11 is the spinal accessory nerve. This is testing the upper trap manual muscle test. So for this, can I have you bring your shoulder to your ear and your ear to your shoulder, and hold this position, don't let me break you. Good. And then same thing on this side. Don't let me break you. Good. And for that one, if they do have weakness with that, that can be an indicator that there is a problem with this cranial nerve. Finally, number 12 is the hypoglossal cranial nerve, which for this one, you're going to ask them to stick their tongue out. All right, good. And for this, you're checking to make sure their tongue comes out straight, doesn't deviate to an angle or to the side. If it does, that is indicating that there is a problem with this cranial nerve.